Vertical incision here. On number 5 we have a bone defect, which is also with a buccal wall. So you can see now the position of the implants. Okay, this is a soft bone there. So, and we have a buccal defect on 5. The implant is in the contour. Okay, this is 2 carrots from the 7 and 5 particulate bone. New buccal corridor with particulate bone, be able to reconstruct every defect in every case with autogenous bone once everything is closed. And 4 months later, we will do apical reposition flap. We need keratinous gingiva around 2 implants here. We have 0 vestibulum. What we did was 2 implants here with the carotid technique here on the implant on this area of number 6. We have here around the tooth nearly 7-8 millimeter keratinous gingiva. Okay, you can see the wonderful healing of the carrot. You see the polish, wonderful carotid technique. Oh, you can see we can close very well the periosteum again. Okay, you can see it's everything closed. Okay, now the stabilization from on the top looks, we have a wonderful corridor again for the both buccal part. 6 millimeter gingiva from 0 movement now. Stabilized, perfect.
I'm Dr. Alex. I come from Romania. I study there. I study dentistry there, and afterwards I work as a trainee dentist in oral surgery. I took my specialization in Romania. And after a couple of years of working in Romania, I changed the country. Now I'm working in Norway as an oral surgeon. And that's the story of my life. So I was not so familiar with Khoury technique. I was doing a lot of bone grafting, like using biomaterials. I was using like a mix between autogenous chips that I would took with the bone scraper and mix it, but I did not took bone blocks, for example. I cannot say I was not happy. I was happy. I was not sad, but it was a day that I had free time, and I saw an online congress of it was I think in India or something. It was a lot of doctors from India that were presented this technique, and between them it was a presentator in person of Dr. Serif, and how to say, he looked to me a little bit sympathetic, he looked funny, and I said, why not? He seems like a good guy, and I was interested in learning from him. I saw he was like really down to earth, you know, because there are a lot of more experienced doctors that they don't take time to teach you. They just present you some notes and God bless you from that on. But he looked like the right guy for me to learn something from him. So this is how it started for me. I always want to be better. I want to try new stuff, new things that gives me adrenaline. That this is how I am. I always want to do the best that I can for the patient. At that point, after doing multiple bone augmentation using biomaterials, I did not like. It was okay, the results, but it looked to me strange, you know, like the bone was white, it was not red. I wanted to try something new, you know, to be better, how to say. And after reading about the technique, and I became curious, and I started believing in that way. But for me, that was it. I wanted to to try something new, to find my way. Exactly. This was my motivation. I wanted to find my way. Okay. So I tried it. That's it. My goal was to perform the technique, because I heard a lot of colleagues that were taking courses and they would not try it because multiple reasons. They are scared, probably they don't have confidence, and I just wanted to do it a couple of times. Of course, I was not sure I'm successful, but I wanted to do it, at least to do it. So, and I did it. So for me, it was a success, how to say this course. I took both of them. I think I took both of them to say, because I like listen to Serif, you know. He's funny. It was entertainment for me to participate at the meeting. So I had also free time from the clinic, so it was nice for me. I was sitting in the couch, listen to other doctors, so it was nice. It was a big jump for me. I mean, after performing a couple of operations using the Khoury technique, using his methods, overall I become more confident. I don't know, my practice, I feel that is it leveled up a little bit on all. It's not just about the bone augmentation. It's overall I felt better. I don't know, and I got decent results. I got good results, and I feel more confident. I don't know. It was a big jump for me. It was a big jump. It's an interesting concept, you know, that it's on a couple of weeks or months. I don't remember how. I was a long time, and you know what I appreciate the most is the availability of Dr. Serif. You know, he's a down-to-earth doctor, even though he has more experience than me. He was always available to say. He was always giving me advice, and it was not that type of doctor that you send him message and you receive a message back after 2 weeks when you finish the case, or you finish the complication and everything. So that was one strong point for me. You know, he wanted to teach me. So this is I don't know, he wanted to. So, and also this is interesting concept, that because of the long period that you have the teaching, it gives you a lot of chances to do operation in case of mistakes. He is there, supports you, gives you advice. It's really important for the beginning to have some support, like to say. I mean, you feel more, you feel better. And also, this is the one that he tried to implement, or he implements with the psycholog. I don't remember the name of the motivator, how it's called. That was interesting also. I like it, you know. It's also psychological, more to motivate the doctors to do this kind of stuff. And yes, that's what I felt. I thought that he's more, you know, more arrogant, as you say. You know, I don't know in English if it's the same. It's more. He surprised me how he is. You know, the person how he is. This surprised me the most. So I cannot say I participated to many congress, and that I've seen also before Khoury technique. So that was, but you know, it's. There are a lot of doctors that perform this kind of operation, but not a lot of them know how to teach this and calmly and to implement. So the students can make this kind of operation. So I was a little bit, because I'm a little bit, so if it's not interesting to me, I don't pay attention. You know, I'm but it was he was an interesting person for me, so I took my time to listen to him, and yeah, he surprised me. The doctor in general, he surprised, not the technique, and he seemed like a good person. So I don't know, maybe this is not a good question for me. I do a lot of things that I don't know what I do, why I'm doing it, but I don't know. It felt the right thing to do. That I was at a point. I was like 30, 32, 31 years old. I wanted to do something new, and I don't know. It seemed fair to me to do these courses. There are, like I said, there are multiple mentors and that present this technique, but he seems the right person for me, so that's why I took it. I don't have other reason to say, like I was desperate and I wanted to take this, and it felt right. That online congress, so that online push, it was the starting point for me from then on. I also recommend now to a lot of my colleagues. I recommend to everyone that asks me that if they want to level up their work performance, I would recommend that it's quite an informative course. It has a big plus that it's for a long period, so you can ask, you get answered quite fast, and everything is explained in easiest way. I don't know, it's like for everyone, even for the ones that just finished their specialization and they can do it. Also, I would recommend, because he has a great team. He has 2 Tanyas. I made him an offer. I don't know. I don't get a response. I said to send me a Tanya from here in Norway. It's good working place for one at least. This is what I learned. You need at least 2 good assistants to perform the technique. So, yes, but I would recommend to everyone now, without joking. For at least it helped me a lot. So I think also for other one. I don't say I'm the most skillful surgeon, but for me, at the level that I was, it helped me a lot. So I'm recommending to everyone.